Okay.
So you've been doing this for 4 years.
Mm-hmm.
Prior to that, you said you also did
I
art
used
therapy.
art in the community. I used art therapeutically, so which is different from art therapy. So artists do engage in social projects and community projects, and they do use art making, but it's not therapeutic. They're not trained in psychotherapy or the therapy fields. So yeah, I was doing that before.
Okay, how's it different from a layman?
From a
I'm asking you, like,
yeah.
so when you use art to help, you work in the community versus art therapy, which therapy is not used loosely by you. It's really a treatment.
It is. So art therapy is a psychological therapy, and art therapy has two, let's say, titles. You can use interchange between using the words art therapy or art psychotherapy. And psychotherapy is a field where you study and analyze the mind with a client, and you're looking at various aspects, their past, their subconscious, the transference, the countertransference, things that go on within that therapeutic relationship. And the therapist needs to consider all this and reflect on this, and the work becomes a bit more embodied. Now, art can be therapeutic, as we all know. And when artists work in the community, they use art, and they use that therapeutic healing potency of art to work with people, so that they are able to, expressing creatively, it's an intrinsic human need, so yeah, so they use that to get people to express, to think creatively, to play, to be able to play. We've lost, a lot of our playing skills as we grow up. So, working with art in the community is very useful, and you can't say one is better than the other. They just serve different needs.
How do you said art is expressing yourself and creating something is intrinsic in people, yet a lot of people may say, I have no artistic talent, yes. I cannot create anything. And when you do the work with Angsana Care clients or patients, they are sick, they are not well. It's like, I feel it's asking a lot from patients to engage in something like that, especially if like earlier we talked about some patients who are very active and they really like to be outdoors more, and being bedridden is hard, or when they've got tubes and needles and stuff stuck in them, they can't do a lot of things with their hands or with their body, right? Yet you're using art as a form of therapy, so it looks like everything's stacked up against them. How is that useful then?
Especially when everything's stacked up, isn't it? Because now you have someone who isn't able to draw, and in art therapy or art psychotherapy, that's never the goal, to get someone to learn how to draw or to get someone to create a beautiful picture. I mean, although almost always, the end result it's so appreciated by the client, and the beauty is it's there, and it's appreciated by the parents, and people can see the value in it. But it's never the goal of teaching someone how to draw, how to paint, or how to make a beautiful picture. But it is allowing someone to be able to express and to be able to experiment and to be able to free their mind a little bit from that constraints of, especially in Angsana Care, the constraints of that metal hospital bed. So
give me a story.
So when I go and see clients, I tell them that I'm here to draw with you, and I'm here to do. Sometimes I tell them it's art psychotherapy. Sometimes they need an explanation. Sometimes I offer that explanation after a session. But usually I say, okay, let's think of an image. We can draw anything in the world. So, in a place where there's so much of impossibility, and in a life of a child where there's so much of limitation, I'm saying anything in the world. And I get a lot of themes. There are some common themes that run, but we try to explore. and they'd come up with something.
For example,
a lot of children anyway, but especially 6 children, they like to draw superheroes. Yeah, so we do a lot of superhero drawings, and this is a first session, so this is usually an undirected session, and it's a session where they're allowed to think up anything and explore anything and draw anything. And then it's also getting them to take charge of that drawing. I'm here, and I'm here to help you do this drawing. Don't worry, and take charge, and I don't want to sit and give them a psychological guides or aids. That'll be too overwhelming for a 7-year-old, fitted with tubes all over. But what I really wanted to do is say, look, see how you can empower yourself through making an art piece. See how while we make the art piece, we talk about this superhero. See how, when you put colors, or when you think about your siblings, or you think about your family while drawing it, we can talk about it and, take ownership of that. And see how at the end of everything, and usually always at the end of everything, you're so impressed by what you have done, what you were able to do. And, be proud of that. Be happy in that in all that you can't do, you could do something really beautiful, and something that, after I leave, that art piece is there. It's going to remain with the parent, with the child. It's going to re-inspire them. It's going to take on a different meaning. So let's say I draw the Hulk, okay? And so maybe when I started off, the Hulk for this client was, something strong and sturdy. But, as it goes on, this Hulk could be something that takes on a bit of the anger and frustration that they would experience as they go through their treatment. And, as it goes on, they might relate to the Hulk to, someone that's being angry or frustrated with them.
Sorry to interrupt, ma'am.
Okay, so you say the Hulk can take on like different meaning?
Or that drawing can take on different meanings as, the client keeps it and the client puts it up by their bed or reflects on it later.
You see them? Do you see them a few times a week or every week, or what? How does your art psychotherapy work?
Well, in a government hospital, it's very different because, everyone's busy with more than they can handle anyway. And you're going in with whatever, even if it's a good, sort of assistance and a good sort of thing for people to use, but no one has really got the time to, accommodate you. So you really have to work very spontaneously. And it's very difficult to find out when your clients are going to be there or when you're going to see them again. And then the other part to consider is the illness, and children and illness. So they might be in this ward today because they are, going through, chemotherapy. And next week it's in the ICU, and the week after they are at home, and or the week after they're in the bone marrow transplant unit. It's so difficult to have some kind of routine, and so the whole mindset of working is we really need to work in the moment, and that's how I do it. So that's why I couldn't bring any of the artworks except save one, because everything goes with them, and they take it home on the spot. And that one session, I really need to think of it as one wholesome and closed session. And if I see on its own, and if I see them, there are people that I've seen 6 or 7 times, but it still has to be in those little bubbles.
So every session with them is unique in itself, and it has to have an opening and a closure, and a lesson or whatever it is you want them to take away.
It needs to be important, and it needs to be of value, and you need to leave the client and the family in a safe place, not an okay place, not a happy place, not at all. I mean, leave someone with sadness or leave someone with, thinking about difficult things, that's okay. But we just need to leave them in a safe place, and that's important for therapy and working in a hospital setting where you really don't know who you're going to see and when you're going to see them. Yeah.
So when you say leave them in a safe place and not knowing, when you'll see them again, so when you approach a patient, what's the first thing that comes to your mind, or what is there a routine that you go through? Like, how do you work with the patient?
So when I come into a bed, I'm looking all around that bed for clues as to what is this patient like, what is the family like, what is the situation that I'm addressing here. Sometimes you get, some information from the doctors and nurses. Sometimes you get a referral, but a lot of the times you're just going in blind. So I'm looking for cues. I'm looking for, how many seats are there, how are their clothing stacked up, what's the kind of food, is it clean, is it neat, what's the parent doing, how many phones are being charged, is there an iPad somewhere, what's this child doing on a day-to-day. And also you're sussing out, because we have a physical age, but we have an emotional age as well. So you're sussing those things out to see, okay, what's the entry point, where can I address this person. And therapy as we know it should be done privately and confidentially, and here you are in the middle of a ward with a client and everyone around, siblings climbing over the bed, a mother breastfeeding on the other side, people talking, the whole ward, in your face and in your space, nurses in and out. So that's, that's the environment that you need to manage. And so, how do I find a way so that amid this massive distraction, I can create, a space
and
for
how
us.
do you do that?
So, I look at the client, I talk to them. Sometimes when they get afraid, because I am an adult, especially for the younger children, I'm an adult, and usually adults come with injections or medication or things that hurt them. So I need to show them that, hey, I'm here, it's a bit safe, and I edge myself slowly to the bed, and I want them to know that I respect their space, and I only want to come in when they allow me to come in. So slowly I get into, then I talk to the parents if needed, and sometimes I do tell the parents that they can go for about an hour and I'll be here, or if they wanted to stay around, just make them feel comfortable, make them understand that, okay, I'm coming into this space and I am going to now contain this space, and I'm going to take charge of this boundary between me and the child. And I slowly do that, and I show them the pieces, the art material that I've brought, or bring in the table, talk about where we can seat them. Can they sit up? Are they going to be lying down on the bed? Does the art making need to come down to them, or can they come up to it? And so we think about that, and slowly this whole setting up, it really physically and emotionally sets up a client. And they're ready. When they're ready, they're ready. And you also have an idea of whether, this person is okay to draw, or okay to paint, or okay to do some kind of art making with you, or maybe, they're not ready yet. And maybe I need to make that first step. Maybe I need to draw, and I need to model what I'd like us to share eventually.
What do you get from them at the end of this session? I mean, you talk about it being all-encompassing in the sense that there will be a takeaway for them, and they're left in a safe place, right? So what do you, maybe you could share like one good case, or yeah.
Okay, so therapy, you see the effects of therapy over a few sessions, So how do you work in a space where you've got one and maybe no more after? So I need to work out what my goal is. And in the hospital for children who are ill, I need to suss out what's the relationship problem within mother and child, brother and sister, doctor and patient. See if there is a loophole that I can go into. If there isn't anything obvious, maybe it's exploration. Maybe it's just noticing. Maybe my first session, if my goal is to only notice what I need to focus on, eventually it's a good session. The other part is to, it's an inhuman space for a child to be chained to a bed and chained to a unit and a drip. It's an inhuman space. So how, if I could bring some humanity, bring some laughter, bring some joy, bring some ability for this young person to see the world differently, to see their pain differently. Or the other thing is, sometimes you have very, very, very positive children with very, very, very positive parents in the light of such adversity. And, that's good, that's very good, that's very useful. But sometimes just denying that experience of feeling fear, and pain and frustration and anger, it's not very useful. You know, eventually it creeps up on the child or the parent. So, you know, if that's the angle, then maybe we just need to do something where we can express that, you know, where we can just get irritated, get frustrated, you know, draw something or use clay or use whatever material we have to express a difficult feeling. And if that is it, that is it. And then, you know, bring the session to a close. And as I bring the sessions to a close, so we're packing up and I'm talking about the piece, and, you know, people come in to look, and, you know, I allow the child to speak about their art piece. And then we decide where to put it, or where if they want it up on the wall. And all these, you know, things kind of, you know, bring a sense of closure. And sometimes you would notice if the child is ready or not, you know, to end the session, and if they're ready not to, you know, to take some rest. And
some other therapists have also spoken about how children or even families may not be receptive to you coming by. You know, they're in so much pain. The last thing they want is to talk to a stranger or to see. How do you deal with that?
So yeah, that happens not very often, really, but not in my experience. But sometimes that you know, pain can blind them to seeing anything beyond you know, that physical experience. So I need to take my time. I need to, you know, show them I'm comfortable in this space, show them that I acknowledge that they are in some kind of pain, you know, not deny what they're going through, but say, oh, you know, that must be difficult, or, you know, ask them about the pain that they're going through, ask them what they're feeling, or what medication is going through their system. Some of them really do know quite a bit about what they're, you know, what they're being administered. And that just acknowledges that, you know, you're in a tough place. I get it. I see you. And sometimes I tell you, for a young kid, just for an adult or another person to just say, I see you. I see you where you are. I see you, you know, from where I am. I don't know exactly what you're going through, but I see you are in pain. That is, you know, it's very uplifting for them, you know. It's very useful for them. So yeah, that happens slowly. And then it you know, if it's a younger child and you throw out some color pencils, it's very unlikely, you know, they're going to resist. But they might resist me because I am an adult. And the adults usually are not there for, you know, pleasure. It's always for some kind of work. So I need to slowly come in. Sometimes I draw on the paper. Sometimes I play with their toys or draw their toys. I know there was this little boy who refused to play with any toy while he was in the high dependency unit. And you know, he refused to play with any of the markers. He was very afraid, just so suspicious of his surroundings. So my way in, you know, was, you know, talking to his parents, sometimes you know, signaling them to move away. Because while mom and dad is there, you know, sometimes it's a bit difficult for them to, you know, deal with me. So move whoever I need to move away. And then my way in was drawing on his hand. And oh, you know, that was what he noticed. So every time he wanted to ask his mom for me, he would point at his, you know, his hand and say, you know, this lady, and then, you know, so yeah, that was my way in for him. Different people. And then you have older kids, you know, 15-year-olds and 16-year-olds that are frustrated, you know, and they can really, really show you that they don't want to see you and they don't want to have anything done, and they just want to curl up in a corner and just wish the world away. So how do you go in, you know? I mean, we need to use our judgment, and, you know, we're trained to see what's useful and when it's useful. And sometimes we need to just let them rest. Sometimes we need to offer them a chance to say, look, I know you're having a difficult time, I'll come back later. You know, it just allows them that chance that I know it's tough and I know you don't want me to barge in now, especially when your mom and your dad is cheering me on and all that pressure of doing some art activities there. But don't worry, just, you know, hold on. I'll come back again. I'll see if you're ready. Sometimes it means that I need to draw. I need to draw for them. And yeah, sometimes for them that itself, you know, is.
So what would you draw for them?
So, like I say, I'm always, you know, sussing out the
Observing.
area, and,
Yeah.
I do talk to them. I do talk, ask them, you know, what their interests are, or, you know, what are they feeling. And there's one example of this young boy. Now, he came into the hospital, and his dad was the one that took leave to look after him, so not his mom. And he was finding it very difficult to accept this diagnosis of cancer. So, you know, he would just cut himself away from the wards, the other kids, the other children, the other parents, even his own family. He wouldn't talk to anyone. He'd just curl up in the bed and, you know, look at his phone or his iPad. So I could see, you know, he felt caught, he felt stuck. So, you know, I came up to him. You know, we spoke about animals, and we spoke about animals who are, you know, in distress. You know, in our short conversation, slowly the imagery moved towards this horse jumping out of a, you know, fired forest. And that was the image that, you know, I drew for him. And I tell you, all he could muster was to lie on the bed and just ever so often look at the image progressing, nothing more. But that session was a very useful session for him. You know, yeah, so sometimes it's just that, you know, and I can't go with the expectation. In fact, I tell parents, because sometimes I go to, let's say, the ICU, and parents would say, oh, Miss Reena, I'm so sorry, this, you know, he can't hold a pencil, or, you know, he can't get up, and I need to get them to understand that I'm not there for the child to put on a show for me, and I don't need their reaction. I'm here for, you know, for this kid to be to give this 1 hour, this wonderful therapeutic hour, where this child is the focus of my attention and the focus of his attention or her attention. So, you know, sometimes it's just that, and yeah, and I have to let people know it's okay. It's okay when children don't react. One lovely anecdote that we have, there's this lovely girl who all of us in the hospital know, because she was there for quite a few months. She was in the ICU, and the only thing she could do was open her eyes and close her eyes. That's it, nothing else. And I was told by the nurses, oh, you know, she might not react, she might not even know what you're drawing, she might not even have the, you know, the ability to understand what's going on, even if you do paint for her. But that's not my focus. So anyway, I did a painting of her. I painted her, but as a princess lying down on a bed. Now, so she's in the same position as she was in the ICU, but just that this time she's got, you know, flowers in her hair and a beautiful background and whatnot. And over time, you know, she moved from ICU to the high dependency unit to finally the regular wards. And I mean, she got better and better and better. And she remembered everything. She remembered the first painting to the last painting, you know, and wow, what a wonderful, you know, what a wonderful thing to hear and to notice. Not that we needed any proof to do what we had to do, but to hear that in the end, you know, it's inspiring. And that's a story I try to tell the doctors, the nurses, the parents, that, you know, don't discount what they see or what they notice. But then again, what about children who really have no mental ability to understand what you're doing? Now, those kids who can't, you know, focus at the painting, you know, really just make funny noises, and they're, you know, shaking, and what happens then? Is art therapy useful then? But so, you know, sometimes me being there, me focusing on an art piece, talking in a, you know, a warm and kind manner, I mean, just in a very calming tones, and me painting a piece, it does sometimes have an effect on how the patient is on the bed, you know, how they calm down. But also what happens in that hour is the mom, the dad, the caregiver, the sibling notices, you know, that this person on the bed that maybe I've discounted a little bit out of life is so special that somebody's come to give 1 hour of, you know, art making and, you know, therapeutic holding. And the effects of those, sometimes you see it right after your session, you know, and sometimes you have people come in and look at the art piece and talk to this child on the bed about the art piece, this bedridden child about the art piece, or ooh and coo at, you know, whatever has been painted. And even that, you know, even that kind of, you know, love and sharing and joy around that bed, that's very useful.
You brought a piece of artwork here. Maybe
So
you could tell us about it.
okay, so this is an art piece painted by a 7-year-old boy. I met him quite a few times, I think about 6 or 7 times. So on this occasion, he wasn't feeling very well. You know, he was an outpatient and he was wheeled in a buggy, a baby's buggy. So he, you know, he couldn't walk, but he came for art therapy in the hospital. And he decided to paint this Mitsubishi car. And he, you know, he kind of, it was from a photo from his mom's phone, but the environment is a bit different. He's taken out his little sister, you know, the car is just him and the car, and he's changed the colors, and, you know, so he's kind of set up the scene, if you like. And his mom and dad were there with me, and they were watching him paint. And you know, it was a lovely session, because eventually, you know, the mom and dad did their own piece of art, and he was doing a session. But in our hour, because he was very weak, he couldn't finish the painting. So I told him that, you know, it's okay, go home, and when you can come next, we will finish it. 2 weeks later, I got an SMS from the mom, and she said that he had passed on. So he isn't able to come and finish the painting. And in fact, she's saying, oh, I'm so sorry he isn't able to come and finish the painting. You know, anyway, so I told the mother, okay, no worries, let me finish the painting and I will mail it to you, post it to you. So now what happens, this artwork that, you know, this boy used to, you know, maybe describe his desire, his dream, his, you know, aspiration to be standing and strong and, you know, beside a Mitsubishi car in the middle of KL City. Now this piece has become something that his parents can remember him by, you know, as something that the family can remember this boy with all the disabilities he was able to work out. And this is a 7-year-old, you know, drawing, which is really good. So yeah.
Okay, you okay with this story? Yeah.